Thank you, Dr. Dong. I stand here basically on the shoulders of all you in the audience, many of the people who my work reflects just sort of summary of their work and their efforts, and I'd like to thank this committee for coming together to sort of address this problem. Much of what I'm going to say is really, I feel, anecdotal because I think you've heard Sid Stahl mention yesterday there's very little data that we can point to. And some of what you're going to hear has actually been stated earlier. What I'm going to try to do is talk a little bit about risk factors of elder abuse and mistreatment, talk about areas of opportunities, and talk about my view on potential interventions. I was told not to talk about epidemiology. You had that before, but I couldn't help myself. I did do some training in Boston. They told me I had to always talk about epidemiology. For my work, you know about the prevalence and incidence of older adults, but in terms of African American women, these were women 50 to 79. We had, over the previous 3 years prior to the study, 0.7% had been physically abused, 8.5% verbally abused, 1.8% had both. If you look at others' work, African Americans are 1.7 to 8.5 times more likely to experience financial abuse, which is probably the leading factor in abuse for older African Americans. African Americans are also more likely than non-Hispanic whites to experience psychological abuse. Much of this you already have heard. In looking at African Americans, both urban and rural, financial exploitation is most prevalent. Work by Griffin et al. Actually showed that in rural African Americans, they are especially vulnerable because many of them don't have the social support networks that some of their urban counterparts have, and are thus left alone and have their financials taken advantage of by the community and others in competition for those farmlands. Older adults in the African American community often are living in shared living situations where they are actually not as likely as some to be with a relative. It may not be a parent, or a daughter, but usually another relative or friend. And often we find that the females that are caregivers are often perpetrators in this abuse from research. Abuse is greater among those who are obviously socially isolated, and these lack of familiar social networks put them at somewhat higher risk, as well as having low social support, again, putting them at higher risk. Another issue related to elder abuse and mistreatment is the issue of alcohol abuse. Clearly, alcohol and drug abuse, as we know, is a risk factor for both intimate partner violence as well as elder abuse. And in the African American community, alcohol and drug problems are more likely in perpetrators than for perpetrators in other minority groups. This is some work that I had done early on, looking at trying to get a sense of the various ethnic communities, particularly African Americans, Mexican Americans, and Caucasian Americans have different views around elder mistreatment, and maybe that could explain some of the issues. And when we did focus group interviews using a technique where we had basically racially unified focus groups, we found a couple things that came out in our analysis. One was that social expectations, filial obligations seem to be similar for African Americans and Hispanics, but maybe slightly different for some of the Caucasian groups. Males and females had different expectations around their gender-filling roles. Had one person said men don't like to cook, they don't like to clean. They say the home is a woman's place. Y'all work, that's the man. And so if you start to cross those boundaries, that is now a man is disabled, relying on a woman for caregiving support, or is danger, and you start to break those cultural norms, that sets up opportunities for abuse because of the desire for control in that relationship. There's an obligation to care for a family member. A lot of older people, their children, they want their children there. Even though they're being abused, they want their families there. They feel that they need to have somebody there taking care of them because that's the responsibility of children. Why did I have you in the first place? I had one older adult tell me. then the issue of identifying abuse. Why isn't this reported? Why aren't we talking about it? Why are people in the community ignoring it? Well, because of embarrassment. In many of the communities, particularly in urban African American communities, when people are trying to be upwardly mobile socially, they don't want to talk about that. It's embarrassing. It puts the family, it makes their name look badly upon in the community. They said some of us know about it, know they've been abused, but especially relatives, they don't want to talk about it. If you report it, then you're going against your kin. There's some things that were characteristics of interactions. There was resistance to care was a major issue because some of the caregivers felt that they didn't know what they should do. When you're dealing with it, that is the older adult, it feels like the mistreatment, it feels like it's mistreatment of the older person. What do? You have to hold them down and give them their medication. The doctor said that they have to take this, so now you have to force it on them. This was talking about an older adult who didn't want to take their medication. And so the child said, well, the doctor told me they have to take it, so I have to just make them take it. Retaliation gets a previous insult. This is big, particularly in both the African American community, maybe a little less so in the non-Hispanic communities. Both communities talked about this reciprocal violence. So she just signed and reciprocated in the next event and broke his wrist. That's it. She kind of defended herself, didn't she? This was talking about a woman caregiver working with a demented parent who pushed her and kept her from not allowing them to go outside. And so she hit him back. You can maybe say this is transgenerational when you talk to parents and young kids. I talked to just a group. In fact, this weekend I had a meeting with the school system in Nashville. And we were talking about the problems in this predominantly African-American school system and the issue of violence with kids. And they asked why the kids are treating each other in such an aggressive manner. Says, well, my mother told me if anybody says something to me or touches me, hit them back. That's just the norm. That now has translated all the way up into older adults. You're training the child to do that. What happens when you become an older adult and that child's now taking care of you and you're demented? Determining the severity of abuse was a repetitive nature. When we started asking them about, well, is this incident we describe in our scenario abuse? Well, a lot of what came out was, well, did it just happen once? Or did it happen multiple times? If it's a repeat offense, it seemed to rise to the level of maybe I need to do something about it. But if it's a one-time event, I just accept it, move on with life. Then obviously the issue of, well, did I mean to hurt them? Well, yeah, I held them down to give them their medication, or I kept them from going out the house, or I restrained them. I didn't mean to do it. Just something I had to do. They got hurt because, they were resisting me. So that's one of the other things we found in our discussions. Again, I talk about victim characteristics. This forcing of medication was something that came up over and over and over again. If I don't do it, am I abusing? If I do it, am I abusing? They feel like they're in catch-22 situations. We're asking them to be caregivers, but we're also asking them to not necessarily abide by older adults' wishes. This is something that was unique, I think, to the African American community, this issue of size. And this issue of, and I guess I'm sensitive because, I used to be a smaller African American male, but now I'm not. So this issue of size. They said the bigger the person is, it tends to be intimidating. So for order me to have control, particularly if I'm a female caregiver, I have to use force. If they're large and verbally aggressive, you can get intimidated. So I'm going to lash out to you in violence. Maybe this is something that we have to deal with society-wise if we're going to really get a handle on this problem. And of course, this issue of complicity came up again, talking about sometimes they know they're being victimized and they just go along with it. If I had time, I would digress, but I don't, so I'll move on. Some of these factors, when I looked at the literature trying to figure out risk factors around attention internationally, some of which you've already heard, so I won't belabor it. I'll just give you a few more details. This issue of infantilization, overprotection. The old adult has no rights. They don't know what's going on, so I have to take care of them. We already heard about older widows being abandoned or having their property seized in sub-Saharan Africa. The mourning rights of widows with sexual violence being forced into marriages to their brothers or other relatives risk expulsion from their homes. The issue of witchcraft, which was a little interesting to me. I'm from New Orleans, so anything voodoo, witchcraft was really important. Witchcraft also was interesting in that this was also connected with abuse of older women, feeling that the local villages, if there was a crop failure, they blamed the older women in the village that they were doing witchcraft and caused harm to the village. And in fact, in United Republic of Tanzania, there was estimated over 500 older women were accused of witchcraft of being murdered every year because of this. So that's an important issue that was pointed out earlier. But what about prevention? So now you've sort of heard the story, what's going on in the communities. What can we do? Well, it depends on how you want to look at it. I'm going to show you sort of what's been stated in the literature. Prevention requires a lot of multiple interventions. This reminds me of chaos theory. You put your finger on one thing and you wind up causing something else, so you need multiple interventions that are small to try to address the problem. With education and dissemination of information that being one of the keys. Unfortunately, there's been no efforts to develop, implement, or evaluate intervention. There's no systematic research that has fully elucidated the best possible sense of intervention. And I hope that this committee and their deliberations tells us what to do. So that's your charge. We have looked at elder abuse interventions. Educational interventions have been the mainstay. Support groups, money management of older adult. Some of them didn't actually have full outcomes, but I think it's all we have. So what I suggest is really what has sort of been the promotion of a multitude of interventions. We have to come to grips with all of these things and try to address them. Issues of legislation, how do we affect laws both here in this country and the world? Looking at education as a place where we educate both the community and our elders to understand what is abuse and what should be happening. The issue of providing respite and social support for older adults and communities and caregivers. Obviously, if you have a caregiver that's in a caregiving situation, how do we intervene to help them become a better caregiver once they've been an abuser? And then obviously money management programs. I'm going to try to take this now to the next step. Many of these interventions you already know about. I'm preaching to the choir. You should be rocking and swaying as I talk. And so what I'm going to try to do is bring this into another dimension. I want us to think a second. Many of what we've talked about really reflect sort of what we know from public health, these classic public health interventions. You heard the previous speaker, Mr. Shaw, talk about this being similar to chronic non-communicable disease. Well, I agree with him in that sense, in that some of the things we need to be thinking about is what are the interventions that we can apply, learning from our public health colleagues to intervene and prevent elder abuse, particularly in the African American community. One, obviously, is education. Have we ever done, at least not to my knowledge, a neighborhood-based education set of programs? Beauty shops, barber shops, churches, well, some churches, I've spoken to some churches, but and high-impact community informants. Have we ever reached out to them? We do it for prostate cancer, breast cancer, hypertension, diabetes. When are we going to start doing it for elder abuse and mistreatment? Are we working with our church colleagues to identify and help them establish and run effective respite programs? Many of them do. Many of them have them set up, and many of our social work colleagues know about them. But are we using them effectively as both prevention and intervention in case of elder abuse? Are we leveraging our community centers? They're sitting there empty during the day. What are we doing with them? When the midnight basketball finishes, daytime respite. Are we leveraging social support? In African communities, there's strong social support amongst fraternities and sororities. Many of our older adults belong to them and are honored as members of these organizations. Are we asking them to step up and provide the social support that's needed? Social and pleasure clubs. Again, I told you from New Orleans. Before Katrina, there was a whole bunch of them. There's still many of them left. These organizations, they gather around Mardi Gras, but what are they doing the rest of their time? They could be providing social support for their older adults. And then alumni associations, especially among the historically black colleges and high schools. These organizations are surprisingly effective if we leverage them to social support around older adults and providing care if they need to. What about abusers? How many of us have set up caregiver training programs? Have we worked with caregivers and talked about conflict resolution? Conflict. How do I resolve a conflict without resorting to abuse and violence? Those are some things that we need to be thinking about, figuring out how do we implement as we move forward. Issue of money management. I think about guardianship services. I remember one of the most rewarding programs I was involved with in San Antonio was a guardianship services organization where we actually created something less than a guardian ad litem, but represented payees for older adults who were in situations where they couldn't handle their finances to avoid abuse and exploitation. We kind of forced, I guess. Forced is not the good word. We encouraged the legal community, so everyone had to do some volunteer work if you were bored in San Antonio to work with an older adult in terms of being a representative payee. And that was remarkably effective in preventing financial exploitation. But when the grant funding stopped, the program disappeared. So can we set those up? Have we enlisted the Black Chamber of Commerce in many of our cities? I can't recall ever going to a Chamber of Commerce or a Black Chamber of Commerce meeting for that matter to talk about issues of elder abuse, exploitation, financial abuse. These are businessmen that should have a concern for the community. And again, I like to again mention churches and community centers. Internationally, we need greater advocacy in the African diaspora. How many of you know that the African Union has a health diaspora health intervention project that's supposed to be working with all African countries? There's very few of us. Some of you are institutions that go and do that. At least on the agenda when I worked with them, there was nothing about elder abuse and mistreatment. That's something that we need to get on their agenda. The Nigerian Coalition on the Prevention of Elder Abuse, I just found out about. Didn't even know it existed. Working with those type of organizations, particularly in sub-Saharan Africa. And obviously, EPIA is one of our major advocacy groups internationally. Are we working with these countries, particularly with PAHO, AU, and others, to help these countries start to look at legislation in their own countries to codify the appropriate interventions to prevent violence and abuse in older adults? Are we helping them set up systems in their public health outreach to do that kind of work that prevents abuse of older adults? We're going to the villages and immunizing all the kids, but are we ignoring the older adults? We need to help address and redefine these cultural stereotypes. I think about the work that was done, and I say great work that was done, although it was incomplete, around the issue of female circumcision. That was a cultural re-education that had to take place. Is it time for us now to do that with many of sub-Saharan African countries? Then finally, obviously, social support and training to those in those communities. So I'd just like to close with saying that the African-American community has mostly similar effects, but some of those are unique risk factors that need to be addressed and can be used to leverage in terms of prevention. And we need to be thinking about leveraging our public health strategies for other diseases to try to bring to bear on the issue of elder abuse and mistreatment. Thank you.